Hi, my name is Queen Validum, and welcome to my capstone video oral presentation on narrative therapy in marriage and family therapy. So let's start off with some background information about the model. Narrative therapy has a central role of storytelling throughout therapy. There's a core belief that the language we use to tell our story or experiences helps to shape our reality. Therefore, there's a great focus on how we tell our story in narrative therapy. The role of the therapist is very important, as we are not the expert on the client's life, but we are the expert on conversation and a curious listener. This means we'll give gentle suggestions, offering flexibility and space for different perspectives on the story told, with the goal of offering a more positive inner voice or positive self talk for the client. This theory is a non pathology based theory as it focuses on the emphasis of the client's experiences rather than solely symptoms or possible diagnoses. It was developed by Michael White and David Epstein in the 1970s to 1980s and is still used today, especially in diverse clients. The personal theory of change is the belief that narrative therapy focuses on the impact of language and perception of reality. Concepts include exploring alternative narratives, reauthoring life stories, the impact on language, and externalizing the problem. Exploring alternative narratives is also an intervention that can be used by offering challenging questions that allow the client to be the expert in discovering new possibilities or new outcomes, or new ways to narrate their story. Reauthoring life stories can be done once the client and therapist work together to understand and identify key problems or rooms for improvement, then deconstructing the story, and eventually re-narrating it in a way that promotes positivity and a more beneficial inner voice. The impact on language is crucial to narrative therapy. The therapist can offer gentle feedback on different ways to reframe or interpret parts of the story with more positive language. It is a hope that this language can become the new reality for the client without diminishing or forgetting about their key troubles or concerns, including their culture, considerations, and background. Externalizing the problem consists of the client and therapist working together in leading that client to be able to fully believe that they are not the problem, but the problem itself is what's wrong in their life. Now moving on to some key interventions in narrative therapy. As we spoke a little about before, externalizing the problem is a very popular intervention for narrative therapy. The problem is the problem, not the individual. There are different ways that the problem can be externalized. One can personify an object in the room and have the client talk to the object as if it was the presenting problem. For instance, anxiety. They talk to a chair and let their feelings out about what anxiety has done for their life. Other ways are through art therapy, journaling, role playing, and answering thought processing questions with the client. Externalizing the problem can also be done with something as simple as writing the problem on a board for the client to see that is not a part of them or their identity, but an experience that happened in their life. Reauthoring the story works to promote a positive personal voice by offering narratives that reflect the values, goals, and strengths rather than focusing solely on what's wrong, but still including their truth in the story. Exploring alternatives is another intervention that can oftentimes be achieved by asking challenging questions that allow the client to reflect on the roots to their problems or the effects of culture and any other considerations. Cultural sensitivity in narrative therapy. Culture and societal effects on the personal story are a big component to an individual's identity. Addressing these concerns is an important part of narrative therapy, as these norms can often control or limit how people see themselves. The role of cultural norms play a big role in a person's belief of who they are. They can see failure or success based on what they're taught or grew up believing in their culture. Honoring cultural backgrounds is important. While we work to externalize the problem and show that there are limits or controlling factors of culture or society, it's important not to neglect true honoring or appreciation of the cultural background. These diverse backgrounds do help shape each individual's life and journey, and it's important to show respect for it while we externalize certain features. Addressing gender is one diversity consideration I'd like to discuss. A specific example would be working with men in domestic abuse cases who are considered to be the perpetrators. Exploring alternative narratives is an intervention of narrative therapy that can be used in addressing these gender dynamics. Typically in society, the perpetrators are considered the evil or enemy in the situation, while the person who experiences the abuse is considered the victim. One can challenge these norms when working with a man who is considered a perpetrator or one who exhibits abuse on their partner. While doing this, exploring alternative narratives intervention, it's crucial for the therapist to consider their own possible biases as a therapist, as they're providing treatment to the male who's often regarded with social norms as someone who can't be helped or someone who is the cause of all of the problems. One way that exploring alternative narratives can be done in this situation, addressing gender and diversity considerations, is leading the male through accepting responsibility for their actions and pushing them to seek ways for change. The questions would start off very light, asking questions such as, who is the cause of the abuse? Who is responsible for the anger that the male experiences? Throughout therapy, as treatment develops, can move on to more pushing questions such as, do you think it's right to allow this other partner to have so much control over your emotions? Depending on the client, it's very important to word these questions in a way that is non-offensive or non-accusatory. Treatment should be client to client, not one size fit all for all clients. So when offering alternative narratives by way of questions, it's important to word these questions in a way that is sensitive to the client's well-being and attitude. A personal application of narrative therapy. The case example that will be used is a 7-year-old foster child that I've worked with personally. There were some cultural considerations as we were different races, different ages, and different genders. Some interventions used were art therapy, and this was used to reframe the narrative. The case example consists of a foster child who was separated from his birth mom and is now fostered by his grandparent. This client often describes his life as sad, horrible, and has passive suicide ideation. A direct art intervention was painting a story of their life. The client described his initial experiences or earliest memories as horrible, sad, negative. One example was, when I was little, my parents were arrested by the police. It was the worst day of my life. After offering challenging questions for clarity, but also to push for more positive self-talk while describing the truth to the story, it was found that the parents were only arrested for one day and reunited with their son. There was a gentle suggestion to add part of the story to the client's reality. The client agreed to add this to the story and shared that it made him feel much better when talking about his life. This is an example of offering an alternative narrative while also externalizing the problem. Flexibility and diversity considerations were used in this case, as the therapist myself offered more friendly, childlike language from the professional wear position in the therapy room, whether it's on the floor, playing games, being extra silly to manage the age gap. It is my hope that narrative therapy can be used to empower clients through their storytelling. Alternative narratives can truly be beneficial in those who experience extremely negative inner voice. Narrative therapy does a great job in addressing cultural concerns, remaining sensitive, and acknowledging and honoring the client's background, while sharing or offering room to consider that these norms may be limiting or controlling to their sense of self. By reauthoring the stories, we create a reality where the client can embrace, and feel more empowered by their experiences.